The first thing that one must understand is that there are very many different types of cancers. And a good way of understanding cancer in the 21st century, in 2024, is that cancer is, broadly speaking, a chronic illness. So cancer shares with it a lot of the facts around chronic illnesses that human beings get. And I think if one understands cancer that way, then one begins to appreciate that in fact one can do a lot about cancer. For example, and very basically, early diagnosis and intervention in all medical conditions is key to success. Meaning that the most important interventions about and around cancer is early detection. And I think because we have all the ability to recognize that every one of us has the potential of developing cancer, then liberate each one of us to take the responsibility of saying, okay, I am a girl. One of the common cancers that get women is the breast, the cervix, and so on. What are the early diagnostic systems that exist for women? And what can a woman do about that? That empowers you. If you're a man, on the other hand, you know that one of the commonest potentially preventable cancers is that of the prostate. So if you familiarize yourself with what a man can do from the age of, say, 40 onwards about early detection of prostatic cancer, then you are no longer feeling hopeless or helpless in the face of the condition called cancer. I think one of the narratives that we need to get out of the way is the sense of hopelessness and helplessness, particularly before and at the point of diagnosis. Now, again, as with any other medical condition, at the point of diagnosis, the human being reacts like a human being. You ask yourself many questions. Why me? Why am I the one who has developed a stroke? Why am I the one who has developed cancer? Why am I the one who has, and so on? That's human. And I think that is where mental health comes in, because it is important to enable the person diagnosed with this, any chronic medical condition, to understand how to live positively with the new diagnosis. And I think because until fairly recently, the diagnosis of most chronic conditions was equal to death penalty, it was right that people felt helpless and hopeless. That is no longer the case. There are thousands, millions of people in the world who continue to live healthy lives, looking after their families, participating in the community in meaningful ways post the diagnosis of cancer. And I think this is a message that we have not conveyed with adequate force, not only to those people already diagnosed with any form of cancer, but the community in general. The second thing that I would like to say is that at the point of the diagnosis, I think both the patient, their doctor, and their families are entitled to 100% disclosure of what they are to be confronted with. And I think those people who are able to deal with the diagnosis successfully are those people who are in receipt of complete and full disclosure of all the available information, whether it's about the seriousness of the condition, whether it's the treatability of the condition, whether it's about the side effects of the conditions, whatever information. Human beings, from a mental health perspective, want to have certainty. They want to have clarity. And part of clarity includes the doctor saying to his patient, I don't know. All right? And I think when I was in training, we didn't really know much about any form of cancer. But in those days, we as doctors were trained to pretend that we knew everything. And we used to get very angry when patients or their relatives asked us any questions because we didn't think they had any business understanding or knowing. It's now moved completely opposite. And I think you will know a good doctor is the doctor who will sit with you and say, I have made the diagnosis of this particular cancer. Go and read the following materials that I have prepared for you about this, and come back with your husband, with your wife, with your uncle, with your father, and let us have a candid conversation about this cancer. We Africans belong to our communities, belong to our mothers, belong to our fathers, belong to our uncles. And once a diagnosis of cancer is made, your uncle wants to know, your aunt wants to know, your father must know. And I think this is something else that we must understand. And a part of what appears like they're poking their noses into our business is because that's just the way they do. When girls get married, uncles want to know. When boys get married, aunties want to know, and so on. When people are diagnosed with a serious condition. And I think we may need to find a way of enabling those who are interested in supporting us. And because treating cancer is expensive, you can't have involved the family. Because on the one hand, you're telling them to come and help you with the fundraising, and on the other one, you're telling them that this is a secret between my husband and myself. All chronic conditions, whether we're talking about heart disease, diabetes, stroke, HIV, cancer, have a number of things in common, which is that they make it more likely for you to suffer from a mental health condition than if you didn't have that particular condition. So, for example, if a diagnosis of heart disease, a heart attack or myocardial infarction is made, or a diagnosis of a stroke is made, the chances that you will have depression, for example, are very high. The rate for depression, anxiety, and other mental disorders in people who have cancer are similarly high. And we know that the earlier these conditions are diagnosed, the earlier they are treated. And the earlier they are treated, the better the outcome. My message to those involved in the management of persons with cancer is to always screen. And it's not just for people who have cancer, it's for anybody who has a chronic medical condition, heart disease, diabetes, stroke, HIV, all of them. You must enable them to get screened for depression and anxiety, because it makes the treatment for the cancer or for the diabetes or for the stroke that much more effective. If you're a doctor and you're treating a human being, every part of that human being and anything and everything that affects a human being is your business. It has been thought previously, and completely wrongly, that people who have chronic diseases, including cancer, don't need mental health support. It's not true. And they need different levels of mental health support, right from psychological counseling to the treatment of formal. The fact that you have been diagnosed with the cancer of the breast, for example, doesn't mean that you will not suffer from common mental disorders. Like what doctors have previously done is to concentrate only on the fact that you have cancer of the breast or whatever it is, and forgetting that the rest of your life continues and that you need a whole person approach in care. From where I sit, I have noticed a very steady increase in the number of medical practitioners who are taking a whole person approach. And my view is that that is a correct approach. One of the drivers of good recovery in medicine in general is the recognition of the centrality of the family unit. And it doesn't matter whether one is talking about recovery from a heart attack, from a stroke, from diabetes, from cancer, from HIV/AIDS, whatever it is. The first port of call that often determines outcome, whether it will be a good outcome or a bad outcome, is a family. And by that I mean the extent to which the family understands the dangers of the condition, but more crucially, the extent to which the family understands what the family can and cannot do to support their loved one with the diagnosis. And I think the paradigm shift that is coming, and I'm happy that it's coming, is that of inclusion. And meaningful inclusion is primarily about knowledge. And whatever materials we develop about caring for persons diagnosed with cancer, that information must include members of the family. Prior to the diagnosis of cancer, we must remember that every human being has a community around them. They have cousins, they have uncles, they have aunties, and many people have a village community of sorts where they meet at matanga, in happy times during weddings, and people into whom the person now diagnosed with cancer has invested over a lifetime in relationships for good and bad times. And as long as you get the permission of the person who's been diagnosed with this condition, inclusion, for example, of a support group within one's church. Because again, remember, clever as we are as doctors in the injections and x-rays that we do, we cannot replace a community. But one of the many things that cancer and mental health have in common 100% is ignorance. And one of the things that ignorance does is that it drives stigma, all right? And when we went around the country as a mental health task force 2 years ago, Kenyans told us loudly and clearly that what they need more than anything else regarding mental health is knowledge. The most important message around cancer for me today is of the importance, number one, of early detection. The fact that when detected early, many cancers are treatable. I think those of us responsible for getting the message across is, number one, to speak about early detection, and secondly, to persuade people that if you identify these conditions early, you can treat and cure without too much expense, financial, emotional, and even physical. This conversation between Kenko and us in mental health at this particular time is critical. For many reasons, those who are working in the mental health space have convinced Kenyans generally that there is no health without mental health. The question of the point at which children are involved and engaged in the management of cancer is interestingly very similar to the question of the extent to which children are involved following the diagnosis, say, of severe depression in a parent. And again, the reason we hide things from children is in some ways out of our ignorance, because we don't know. You don't know what to tell the child. You don't have the information yourself. And that's why it's so important for full disclosure at a very early age. But equally important is the age appropriateness of the information that you give to the child. You need to be clear that the information you are giving the child is age appropriate and therefore mentally digestible. The critical point is in saying, yes, children are entitled to participate, yes, children are entitled to know, but depending on their age, meaning that you don't want to say too much and you don't want to say too little. But most crucially, you don't want to lie. Yes, you can tell the truth that is age appropriate. We have now a big, highly trained and effective army of doctors in this country, both in terms of the general medicine, in mental health, and specialists in cancer care. And I think you need that kind of army of knowledgeable Kenyans to be able to deal with the challenges that are before us. But I have to keep repeating this. The message about early diagnosis, I think, is getting home. It's not home yet, but it's getting there. And the number of men and women who regularly expose themselves to one form of examination in terms of early detection and prevention, in my view, is increasing. So difficult as 2020, 2022, 2024 may be, at this rate that we are going, I am happy that we as Kenyans are getting there, slowly but steadily. I would like to say that I am convinced beyond doubt, as one who has practiced in this country in excess of 50 years now, that we as a Kenyan community are approaching this problem in the right manner, the shortage of resources notwithstanding. And I would like to urge Kenco and the Kenyan community in general to just press on. It's a noble task, and blessings will come plenty to those who continue working for those that we must serve.